As people begin stepping up their own measures to beat this virus, today the question was whether the government would too.
Chief Medical Officer, is it time to ramp up the response, do you think?
This morning, officials and ministers arrived to make that call at another emergency COBRA meeting.
It's very much looking at all the scenarios and under control.
But for how much longer? Afterwards, the Prime Minister announced that while nothing has changed today, it is likely too soon.
We remain in the contain phase of the outbreak, but watching what is happening around the world, our scientists think containment is extremely unlikely to work on its own, and that is why we are making extensive preparations for a move to the delay phase.
And delay won't just slow the virus, but potentially hold up millions who could soon be asked to stay at home.
We are now very close to the time, probably within the next 10 to 14 days, when the modelling would imply we should move to a situation where we say everybody who has even minor respiratory tract infections or a fever should be self-isolating for 7 days afterwards.
So those with symptoms who don't need hospital treatment will have to stay indoors at home, where many won't be able to work.
If they're asking people to self-isolate, then people on 0 hours contracts, working in the gig economy, need access to statutory sick pay from day one. Otherwise, people will be asked to make a decision about financial hardship or their health. We don't think that's fair.
The government's resisting even more drastic measures as the number who've died here reaches 5, including a patient in Wolverhampton and tonight another in South London, both in their 70s with underlying health problems. Today, France postponed this week's Six Nations match in Paris, while the country they were due to play also cancelled celebrations for St Patrick's Day in Dublin.
Other governments across Europe are taking more drastic steps now. Are you suggesting that perhaps that's due to political pressure rather than sound scientific advice? And are you absolutely sure you shouldn't be doing the same thing?
First of all, I think that the best answer to that, Paul, is just that the phenomenon, the epidemiology, may be different from one country to the next. And I think it's very, very important that we in the UK are guided by the best and the latest scientific advice, and that's what we're doing.
This won't be the last update on this virus, as the government warns we may all soon see the symptoms of its spread. Paul Brand, News at 10, Westminster.